the regions that lacks vaccines is Africa. And to talk to us a bit more about this is Jaap Boom. He's an epidemiologist and regional representative for Doctors Without Borders. Thank you so much for joining us, sir. Poorer nations, many in Africa, are critically lacking vaccines despite the existence of the COVAX mechanism. Who do you think is responsible for this situation?
The COVAX initiative was relying mainly on the AstraZeneca vaccine, and the vaccine was produced in India. So when the Indian country also has an important wave, they decide to focus and keep the dose for their own country, which is understandable. But eventually, it means that African country that was relying on those vaccines has no dose. Uganda, a country where we have a research center currently, they have vaccinated less than 1 million of people in a country with 45 million in the population. So that is one of the challenges.
Now, some African states are struggling to use the small vaccine stocks that they actually have. Is it vaccine hesitancy or is it problems with the logistics?
First of all, it's important to clarify that 80% of the dose of vaccine available in the continent have been used. And now you have a diversity. In Africa, you have countries like Cameroon, country like Niger, that has not seen the same wave as you are currently seeing in Uganda. And therefore, the population are less likely to take the vaccine. So the hesitancy is actually an evaluation of risk, as we've seen in the Western countries before you have the second wave. While in the other hand, you have all those countries that are seeing a high number of cases, but more importantly, a high number of severe form and death. Those are the ones where the population is really seeking for a vaccine and they are not available in good numbers.
And of course, the COVID situation, as you mentioned, there varies from one country to another. But what are some of the countries that are cause for concern right now?
Currently, we talk about South Africa, we talk about Uganda that I mentioned, we talk about Kenya, Namibia. So those countries are seeing a country like Uganda. The first wave, they had a very low number of cases and deaths. And now, in the last 2 weeks, they have been seeing an important rate, mostly due to the Delta variant. So it's quite critical, and we are quite concerned. We even have to put on standby our research center, which is in Barra, because of the high number of cases.
Now, Mr. Boom, from your professional experience, what are some of the most urgent things that need to be done for countries like Uganda to deal with their latest COVID wave?
I think the first thing is to make those vaccine available, because they put in place a lockdown, which means they try to protect the people that have not been exposed yet. So those people need to have the vaccine, that one. And secondly, we need to make sure that the hospital has enough oxygen, human resource, so that they can also be in a position to take care of those people who will come with COVID and other disease, of course, because COVID is not removing all the other infectious disease that you can see in Uganda in all those countries.
All right, that's all we have time for. Thank you so much for your clear analysis. That was Jaap Boom from Médecins Sans Frontières.